Angie Dominangato, looking for her delegation at the present time.
We can hear you, but we cannot see you.
Okay, let me try and fix it. Start my video. Thank you. Okay, good. Okay, figured it out. Okay, thank you so much. I'd like to thank all the mayors and council members of the Niagara region for the opportunity to speak to you tonight. My name is Angie Dominangato, a lifetime resident of Niagara Falls, except for my university and college education in Hamilton and Ottawa. I am a retired clinical dental hygienist of 32 years in 4 different specialties of dentistry, involving orthodontics, oral surgery, children's dentistry, and periodontics. Thus, I am very familiar with science and reading studies. To start off, let me take you back to March 8th, 2020, and the program that I'm sure you will all recognize is 60 Minutes, in which Dr. Anthony Fauci, the appointed director of the National Institute of Allergy and Infectious Diseases in the United States since 1984, an infectious disease expert, stated, "There is no reason to be walking around with a mask." Later that same month, on March 30th, 2020, Dr. Theresa Tam, Canada's Chief Public Officer, continuously recommended against wearing masks for several reasons. These included to protect the healthcare workers and prioritize supply, as well as current scientific evidence which says that putting on a mask on an asymptomatic or uninfected person is not beneficial. She also said masks can give a false sense of security, and if used incorrectly, can actually contribute to the transmission of the virus. At the Niagara Region Council meeting on July the 8th, Dr. Hirji, the acting medical officer of health, stated, "We want to obviously be mindful of the potential harms of this. Right now, there's not a lot of science being done around the potential harms of community wearing masks because that is something that has not happened in the North American context. And so it has not been researched. And so I'd be wanting to see what is the emerging data that might arise so that I would have an understanding of what is the benefit versus harm equation." At that same meeting, one of the counselors kept asking the rhetorical question, "Why now?" Yes, why now? Why not in March when we locked down for 2 weeks to flatten the curve? Why the end of July? And now in September for another proposed 6 months? What is the rationale for mask wearing? Why have we now arrived at this point that the population needs to be masked? Dr. Russell Blaylock, a nationally recognized board-certified neurosurgeon of 26 years, health practitioner, author, and lecturer from the United States, says, "Why, with a virus that is a relatively benign infection for the vast majority of the population, and that most of the at-risk groups also survive, from an infectious and disease and epidemiological standpoint, by letting the virus spread through the healthier population, we will reach a herd immunity level rather quickly that will end this pandemic quickly and prevent a return next winter. During this time, we need to protect the at-risk population by avoiding close contact, boosting their immunity with compounds that boost their cellular immunity, and in general, care for them. One should not attack and insult those who've chosen not to wear a mask. As these studies suggest, that is the wise choice to make." Is that not what they did in Sweden? According to the New York Post article on August 19, 2020, by Jackie Salo, Sweden's top infectious disease expert, has resisted recommending face masks for the general population, arguing it is very dangerous if people believe that coverings alone will stop the spread of coronavirus. The chief epidemiologist at Sweden's Public Health Agency is Dr. Anders Tegnell, who has argued that evidence about the effectiveness of face mask use was astonishingly weak. On May the 11th, 2020, Dr. Blaylock posted, "Not only do face masks fail to protect the healthy from getting sick, they also create serious health risks to the wearer. The bottom line is that if you're not sick, you should not wear a face mask." He continued, "This is somewhat of an unusual virus, in that for the vast majority of people infected by the virus, one experiences either no illness or asymptomatic or very little sickness. Only a very small number of people are at risk of potentially serious outcomes from the infection, mainly those with underlying serious medical conditions in conjunction with advanced age and frailty, those with immune compromising conditions, and nursing home patients near the end of their lives." This medical doctor researched 17 of the best studies which he conducted, none of the studies established a conclusive relationship between mask or respirator use and protection against influenza infection. We must be careful to remember that no studies have been done to demonstrate that either a cloth mask or an N95 mask has any effect on transmission of the COVID-19 virus. Thus, recommendations must be based on studies of masks and the influenza virus transmission. We must also remember that it was not until April 30th that Centers for Disease Control formally recommended that Americans wear masks in public, after 2 months of stating precisely the opposite. On May 20th, Dr. Tam officially recommended that everyone should wear a cloth face cover when they have to go out in public. As an avid sewer, quilter, and needleworker, I need to ask, what constitutes a cloth mask? According to the Association of American Physicians and Surgeons article on July 30th, 2020, titled Sound Off on Face Masks, in which research on different types of masks and their filter efficiency was determined, resulted in t-shirts, 10% efficiency, scarves, 10 to 20%, cloth masks, 10 to 30%, sweatshirts, 20 to 40%, towels, 40%, and handkerchiefs, 2% for 1 layer and 13% for 4 layers. How many people do you see wearing a bandana or a handkerchief? The reason I discuss this, as it appears that it does not matter to people what your mask is made of, as long as it is a facial covering for your mouth and nose. Dr. Sherry Tenpenny, an osteopathic medical doctor, board certified in emergency medicine, osteopathic, neuromuscular skeletal medicine, as well as integrative and holistic medicine with over 30 years of clinical medical experience, posted on July 16, 2020. After reviewing more than 50 articles, she discovered there are no randomized trials, controlled trials with verified outcomes that show a benefit to healthcare workers or community members for wearing a mask or a respirator. There is no such definitive study. Likewise, no study exists that shows a benefit from a broad policy to wear masks in public. She went on to state surgical masks are primarily designed to protect the environment from the wearer, whereas respirators are supposed to protect the wearer from the environment. Balazzi and all others study. Patricia Neuenschwander, a board-certified pediatric nurse with 25 years experience as a registered nurse from Michigan, researched 7 different studies of masks in May of this year. And after her analysis, she came to the same conclusions with every one of the studies. The science does not support healthy people wearing masks, and they can potentially cause harm. She discovered a study from March 2011, which was the first randomized control study of cloth masks. And she discovered that moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. Also, researchers from the University of Illinois at Chicago School of Public Health reviewed the scientific literature more recently and determined we do not recommend requiring the general public who do not have symptoms of COVID-19 like illness to routinely wear cloth or surgical masks because there is no scientific evidence they are effective in reducing the risk of SARS-CoV-2 transmission. In the same article, Patricia quotes Dr. Mike Ryan, epidemiologist who specializes in public health. He is the executive director of the World Health Organization Health Emergencies Program. At a media briefing, he stated, there is no specific evidence to suggest that the wearing of masks by the mass population has any potential benefit. In fact, there's some evidence to suggest the opposite in the misuse of wearing a mask properly or fitting it properly. The Centers for Disease Control knew from February 26, 2020, when the first community spread case documented in the United States, that this virus was transmitted from person to person. And not only were there no recommendations to wear a mask then, they strongly opposed the general public wearing masks. The Centers for Disease Control has also known for decades that the influenza virus is transmitted from person to person, but we have never been told to wear a mask before to prevent the spread of that virus, have we? Actually, the Centers for Disease Control specifically says masks don't work. What actually happens, according to Patricia Neuenschwander, is that it is uncomfortable for everyone to cover their mouth and nose for hours. It also limits the airflow and flow of oxygen coming in. This in turn causes people to breathe in their own carbon dioxide as a result, which is harmful. Additionally, masks provide a dark, warm, moist environment that potentially increases the risk of infection. According to another May 11th, 2020 article by Dr. Blaylock, he exclaimed, "By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, entering the olfactory nerves and travel to the brain. Is anyone telling the frail elderly and those with lung conditions like COPD, pulmonary fibrosis, or emphysema
As you're
of
now
these
in excess,
dangers?"
as you're now in excess time, I'm going to ask you to wrap up because 10
It
minutes
is.
is 10 minutes
This
is all it
is
takes.
the end. This is the end. Is anyone telling the frail elderly and those with lung diseases like COPD, pulmonary fibrosis, or emphysema of these dangers which can cause severe worsening of their lung function? It's significant to note that a drop in oxygen levels or hypoxia is associated with immune system impairment. This sets the stage for contracting any infection, perhaps even COVID-19, and making the consequences of that infection much graver. Consider also cancer patients, whereby a low oxygen environment can lead to growth, metastases, and spread throughout the body. Dr. Blaylock reiterates that reduced oxygen is an important risk factor for heart attack and strokes. During this presentation, I've emphasized the scientific data since all of our politicians focus on this, but have they read the studies? However, I could also talk about the legal implications and so many personal stories to emphasize the human impact of wearing masks, not to mention the environmental impact. Conclusion, for so many reasons, mask wearing should not be obligatory. Thank you.
Thank you for your delegation.